On this, let's bring in our health correspondent, Nicola Hill, who joins me from London. Great to have you on the programme, Nicola. What more do we know about this drug?
Well, it's certainly optimistic news, isn't it? And it's something that the scientific and medical community are certainly discussing in great detail. So what we learnt about the human trials that are underway at the moment was a leaked video recording of doctors discussing the results of the part of the trial that's underway at the University of Chicago Medicine. They have 120, or they had 125 people taking part in this trial, 113 of them seriously affected by COVID-19. And as you just said, most of them went home within days. They noted that some people were able to come off the ventilators within 1 day, which is amazing because normally people are on a ventilator for much, much longer than that. Now, 2 people unfortunately did die, but considering the numbers of people who normally die when they're hospitalised on a ventilator with COVID-19, that's amazing. However, I do have to say that the makers of Remdesivir, Gilead, are very cautious about these results. I spoke to somebody from the company, and they said that this trial in Chicago is just part, these patients are just part of much larger trials involving 6,000 patients. And what was seen in that hospital, they can't guarantee, will also be seen in other hospitals taking part in these trials, both moderate and severe patients with moderate and severe COVID-19. But they also are ramping up manufacturing of the drugs. They say that by May, they should have enough to treat 140,000 people, and by December, up to 1 million people. And we're hoping to find out more details about the trials, the results of patients who are in the trials in other parts of the country and the world by the end of this month and next month. So we're all just watching this space.
Absolutely. And I know it's early days yet, but how does Remdesivir compare to I can never say it properly, hydroxychloroquine, which is being tested here in Turkey and so many other places, hydroxychloroquine even, that's being tested in Turkey and being used in Turkey and many other places around the world?
Well, I think eventually we're going to need more than one treatment, and basically the more drugs that are effective against COVID-19, the better. Now, as you said, I know Turkish doctors are certainly using hydroxychloroquine as part of their paradigm of treatment, along with proning patients, putting them on the front so that the lungs and the back of the body can have more chance to be effective, and also giving patients with massive doses of oxygen. And interestingly, in Turkey, the hydroxychloroquine is being given slightly earlier on in a patient's, to use that expression, patient's journey, whilst the patients have the disease. Now, Novartis, who is one of the major drug companies, has today announced a study of 450 people, patients, using hydroxychloroquine, and it's going to be given to patients in the study similar to the patients in Turkey, i.e. a little earlier on, not when they're on a ventilator. Now, this is going to be the first large, major gold standard trial because it's going to be double blind. In other words, patients are going to either be given hydroxychloroquine or hydroxychloroquine and an antibiotic, or placebo, which is a dummy drug. And neither the patients nor the doctors will know which one they're getting. And Novartis is hoping this is going to add to the knowledge base about this drug, which actually is an antimalarial. And there has been so much conversation about it because, of course, President Trump was talking very positively about it. I know here in the UK, it's involved in a couple of trials in 2 hospitals. And, of course, it is one of the 4 drugs that's in the WHO's Solidarity trial, which is looking at potential treatments for COVID-19.
All right. Nicola Hill, thank you very much indeed. And I will practice hydroxychloroquine a lot before I speak to you tomorrow. Take care. Thank you.